Hello. Welcome back. It's nice to see you again. Do you want to continue where you... Now, as you probably know by this point, gastric bypass surgery makes permanent changes to your body that can help you lose weight and help with problems like diabetes or high blood pressure. But before we talk about the surgery, let's talk about your digestive system. It includes your stomach, your small intestine, and your large intestine or colon. Okay, so let's start with the stomach and how food moves through your digestive system. As you know, food travels to your stomach where it's broken down. And from the stomach, the now mushy food moves into the small intestine. In the first part of the small intestine, food gets broken down even more, so it's small enough for your body to absorb. And these smaller particles continue to move through the rest of your small intestine, which, by the way, is 15 to 20 feet long. And as this happens, the small intestine absorbs calories, vitamins, and other nutrients. And then whatever your body does not absorb moves through your colon and out as waste. So, how does gastric bypass change this system? Well, it does a few things. It reduces the size of your stomach to a small pouch, about the size of an egg. With a smaller stomach, you'll feel full sooner and will be less likely to overeat. Now, gastric bypass also creates a new pathway. So food moves from the new stomach pouch directly to the lower part of your small intestine. This new path goes around or bypasses the larger stomach and a part of the small intestine. And when food travels through only this part of your small intestine, fewer nutrients and calories are absorbed. This may also affect some of the hormones that control things like your appetite. So many people feel less hungry after surgery. And together, these changes help you lose weight and may help improve conditions like diabetes or high blood pressure, which is great. But here's something you really need to understand. Gastric bypass surgery is not a quick fix. Combined with diet and exercise, it's a tool to help you lose weight. Even after surgery, you will need to be very careful about what and how much you eat. And that's going to take a big commitment from you and plenty of support from others. So let's talk about that. Now, your decision to have this surgery most likely reflects your feelings about your weight and your health. As you know, being very overweight can lead to other problems like heart disease, diabetes, sleep disorders, and infertility, among many others. Losing weight and keeping it off can reduce the stress of these conditions on your body. In some cases, they may go away entirely. But gastric bypass surgery will significantly change the way you live your life. For many months or even longer, you'll only be able to eat very small amounts of food, very slowly. And you'll no longer be able to eat the large portions of food you may have gotten used to over the years. What you'll eat, how much, and when will be completely new and very controlled. Gastric bypass is permanent. So that means you have to be committed to changing the way you eat and other habits for the rest of your life. Chances are food has been a source of comfort or a stress reliever for you for many years. That complicated relationship won't magically change the day after surgery. Even with a smaller stomach, you can still eat too much. And if you're not careful, you can start gaining weight. Also, some people, when they can no longer eat as much as they're used to, can become depressed. Or they may turn to other unhealthy behaviors to help them deal with stress. So, before surgery, talk to your surgeon about meeting with a psychologist or a therapist to discuss things like why you're thinking about surgery now, the results you're hoping for, and how surgery can help you achieve those results. Okay, one other thing you need to know. It may be very difficult to get to your ideal body weight. What surgery can do is get you to a healthier body mass index, or BMI. As you may know, BMI is a number that's found by plugging a person's height and weight into a formula. And this number is a good indication of how much body fat someone has. The goal is to lower your BMI. And gastric bypass can help many people do that. At this point, do you want to make any notes? Okay, let's move on. Now, of course, your surgeon may be a man or a woman, but just to make things simple, I'll refer to your surgeon as a he. All right, in the weeks or months before surgery, it's very important for your surgeon to learn about your overall health and health history. So tell your surgeon if you have any health conditions or you're allergic to anything like penicillin or latex. And tell him if you or anyone in your family has ever had a bad reaction to anesthesia. Also, you may need to get some medications out of your system in the weeks or months before surgery. Why? Well, some medications and herbal supplements can put you at a higher risk for bleeding or blood clots if you take them right up to the day of your procedure. So, for your safety, make a list of everything you take, and this includes all prescription medications, any other medicine like aspirin, Advil, or Motrin, vitamins, herbal supplements like echinacea or ginkgo biloba, and recreational drugs. And if you take a blood-thinning drug, you'll need to talk to the doctor who put you on this medication to find out exactly what to do. These include medications like warfarin, also called Coumadin, Plavix, Pradaxa, Xarelto, Eliquis, and many others. Do not stop taking this kind of medication on your own. Your doctor needs to help you do this safely. For a complete list of what to stop taking and when, ask your surgeon. It's also important to know which medications you should keep taking. So if you take medication now for conditions like high blood pressure or diabetes, make sure you talk with your surgeon about this. And if you smoke or use anything with nicotine in it, including nicotine patches or gum, make sure your surgeon knows. People who smoke have a higher chance of getting pneumonia after surgery, and smoking can cause serious healing problems. It's a big deal. Your surgeon may tell you that you need to quit before he'll do the operation. Now, it's also important not to gain any weight in the weeks before surgery. So your surgeon or dietitian may put you on a special diet and have you start getting used to some light exercise like walking. Be sure to ask about this. You'll also learn about your new food plan for the days, weeks, and months after surgery. There's a lot to learn, more than we can really get into here. So ask for information that will help you create menus, shop, and set up your kitchen. Okay, on the day of your procedure, it's a good idea to have a family member or a friend there with you for comfort and support. Think of this person as your partner in care. Doctors and nurses like to have one go-to person for all communication. He or she should be able to speak up for you, ask questions, and give information about your health. Be sure to introduce this person to your doctors and your nurses so they know it's okay to share your health information with them. Okay, on to the night before surgery. You'll probably get a list of instructions telling you what to do, but I'll mention one very important thing here. Find out when you need to stop eating or drinking before your surgery. Why is this important? Well, if there's anything in your stomach and you throw up during surgery, it can be very dangerous. So find out exactly what your doctor's instructions are for you. You'll need to follow them, or your surgery may need to be rescheduled. Now, on the morning of your surgery, your doctor may have you take some or all of your regular medications, and you may need to take them with just a sip of water. All right, that's what you need to know beforehand. So let's talk next about how the surgery is done. Your surgeon will have a specific plan for your operation and recovery, but I'll give you a general sense of how it'll go. Before surgery begins, you may have compression devices like these placed on your legs or feet to help reduce the chance of blood clots. And they'll start your anesthesia. This surgery is done under general anesthesia, which puts you into a deep sleep. First, an oxygen mask will be placed over your mouth and nose, and you'll be asked to take deep breaths. Then you'll get the anesthesia through your IV. The medication may sting or burn a little bit when it goes in, but don't worry, that's normal. Very quickly, you'll fall asleep, and after this, you really won't remember anything about the procedure. And you'll most likely get antibiotics through your IV to reduce the chance of infections. Now, once you're asleep, a tube may be placed in the back of your throat or down your windpipe to help you breathe. Don't worry, you won't feel the tube going in, but when you wake up, your throat may feel a little sore. Sometimes another soft tube may be placed in your bladder. This drains urine from your bladder into a bag. And when everything's ready, they can begin. This operation generally takes between 2 and 3 hours. Surgery begins with a single small cut near your belly button. Then your belly is filled with a gas to create space, so it's easier for your surgeon to operate. A slim telescope-like tube called a laparoscope is then placed through the small cut. The laparoscope is attached to a video camera, so your surgeon can see the inside of your belly on a TV screen. A few other cuts are then made nearby so he can insert special tools. Once everything is in place, he'll start the bypass by separating the stomach into 2 parts, a small gastric pouch and a larger part. And each will be stapled shut. And just so you know, these staples will not be removed. So this smaller gastric pouch is now the new stomach. And the rest of it will be left in place. It'll continue to produce digestive juices. The small intestine is then cut, and the lower part of it is brought up and attached to the new, smaller stomach. This is the bypass. Then the upper part of the small intestine is reattached to the lower part of the intestine, so bile and other digestive juices can flow easily. Your surgeon then checks the new connections for any leaking. At this point, he takes out the scope and gas is removed from your belly. He'll then close the skin with stitches, staples, or clips. Sometimes a small tube may be placed to drain any extra fluid. The tube will probably be removed before you go home, and that's it. Your next stop is the recovery room. At this point, do you want to make any notes? Okay, let's move on. After surgery, expect to feel groggy and a little out of it when you wake up. If you feel sick to your stomach or have the chills, just ask your nurse to help you get comfortable. In recovery, you may be hooked up to some monitors and your IV for medication and fluids. Now, as soon as possible, your nurse will help you get up and walk. Moving around helps prevent blood clots. But don't try to get up by yourself. A nurse will need to help you. Your team can give you medication to help with any pain or soreness. Now, breathing deeply is also very important as you recover. In fact, you may be asked to use a device like this called an incentive spirometer. It looks like a small plastic toy. As you breathe in, a little ball flies up to show how deeply you're breathing. Taking deep breaths helps prevent infections like pneumonia. Now, you may be wondering, what will I eat right after surgery? You'll probably start by sucking on ice chips and drinking fluids. It goes really slowly because your new connections are healing and need to be treated gently. To make sure that food and liquid can easily pass through the new stomach pouch and intestines without leaking, your surgeon may have you do something called a contrast study, also known as a swallow study. For this, you'll swallow a special drink that shows up on x-rays. Okay, now, about your medicine. Don't be surprised if your medications change. Some of your old medications may be stopped because you don't need them anymore, and some new ones may be started. As you'll learn, there are a lot of do's and don'ts after gastric bypass surgery. Here's a big one about medicine. Your surgeon may tell you to never take an aspirin or anti-inflammatory pill like Advil or even Alka-Seltzer again. These can cause ulcers in your new stomach pouch. But for things like headaches, doctors usually say Tylenol is okay. Again, ask your doctor to go over this with you and even write out how to take your medication and what you need to stay away from. And ask your surgeon when you can expect to go home. With this procedure, most people go home after 1 or 2 nights. But this can depend on your condition, how the procedure is done, and other things. So again, just ask. And be sure to have someone drive you home and stay with you. In fact, you won't be able to drive for a while. Ask your doctor how long he recommends. Also, before you leave, make sure you have a follow-up appointment to see your surgeon and other members of the healthcare team as necessary. Most likely, you'll have another appointment within the first 2 weeks after surgery. You may also need to get your stitches or staples removed a week or 2 after surgery. But some kinds of stitches dissolve on their own and don't need to be removed. Ask your surgeon what you can expect in your case. You'll see your healthcare providers regularly for the first year or two, but it usually doesn't end there. Expect to have follow-up visits each year to make sure that you are in strong health and there are no problems. Many people go in for follow-ups for at least 5 years. All right, now, you're probably wondering, am I going to be in a lot of pain? Well, most people say that it's actually not too bad. Of course, your surgeon can give you medication to help with any pain and soreness. But just make sure you understand his instructions on how and when to take it. As you recover and adjust to your new stomach, you'll probably feel pretty tired for a few weeks. And although you may not feel up to it, you'll actually feel better if you get up and walk around. Walking is a great way to regain your strength and just overall feel good. So try to work up to walking every day for at least half an hour. Just take it slow at first. And of course, you've just had surgery, so your surgeon may have specific instructions as you recover. For example, he may say not to lift anything heavier than a gallon of milk. Getting back to work or school and any regular activities really varies from person to person. If you have questions about what's okay to do and when, please ask your surgeon. Now, about food. Every program has a slightly different plan, so I don't want to get too specific. Your doctor will go over your specific instructions with you. But the one thing that everyone learns is, once you're eating solid food, you will need to eat very small amounts and chew it really well before swallowing. You'll be surprised at how quickly you'll feel full and how long it will take to eat even a couple of bites. And every doctor and dietitian will want you to drink plenty of water. Eat foods high in protein, like chicken and fish. And take vitamins. You'll probably need to take a daily multivitamin and mineral supplement for the rest of your life. B12 and a multivitamin are essential. Your doctor or dietitian may have you take calcium, iron, and folate supplements as well. But be sure to ask which vitamins you'll need and how to take them. Oh, and just so you know, you may lose a little hair as you and your weight management team work to get the nutritional balance right. This should only be temporary, but it's a good reminder that meeting your nutritional goals will pretty much become your job. And it's critical because if you're not getting what your body needs, you could land in the hospital. Now, you may notice that certain foods just don't agree with you anymore. Some people avoid red meat, dairy, or certain fruits and vegetables, but you'll learn what works and doesn't work for you right away. As a rule, you should avoid all high-fat and high-sugar foods. When you eat fatty or sugary foods, you may sweat, get cramps, feel lightheaded, feel your heart race, have diarrhea, or throw up. This is known as dumping syndrome. It's a sign you're not eating right, but not everyone has it. So don't count on it to tell you when you need to get back on track. And a word about alcohol. Talk to your doctor about drinking alcohol after surgery. Alcohol has a high sugar content, so it can get you into the trouble we just talked about, not to mention slow down your weight loss. Also, after this surgery, alcohol will affect your body much more quickly, so it'll probably take a smaller amount to make you feel tipsy, and you'll get dehydrated faster. And alcohol's bad effects on the liver will be a lot worse. All right, now let's get to the question I know is on your mind. How much weight can I expect to lose? Well, generally speaking, most patients will lose at least 1/2 to 2/3 of their excess weight in the first year. Now, your excess weight is the difference between your current weight and your ideal weight. So a person who weighs 300 pounds with an ideal weight of 180 pounds has an excess weight of 120 pounds. Now, as you lose weight, you should be closely monitored if you were being treated for high blood pressure, diabetes, or other medical conditions. Your medications may need to be reduced or even stopped, and you may see improvements in these conditions even before most of the weight is off. Also, women should wait at least 1.5 to 2 years before trying to get pregnant. At the same time, you should be aware that birth control pills may be less effective after weight loss surgery. In fact, they may even make it easier to get pregnant. So, if you're a woman, ask your doctor what you should do to make sure you don't get pregnant for the first 18 to 24 months or so after surgery. And of course, if you have any problems during recovery, please call your surgeon. Call right away if you have a fever of 101 degrees or higher, sudden shortness of breath or chest pain, if it's difficult or painful to urinate or pee, you have pain or swelling or fluid leaking from your wound, pain, redness, or swelling in one or both of your legs, worsening pain in your belly, back, or shoulders, or call if you experience anything unusual. The bottom line is, if you think something just feels wrong, please call. People who commit themselves to their new post-surgery lifestyle enjoy the many benefits of gastric bypass surgery. Losing weight may reduce the chance of serious health conditions. You should have more energy and find everyday tasks much easier to complete. And your self-esteem may improve as your body changes. You may feel more confident and willing to try new things. But like any surgery, gastric bypass has risks that you should be aware of. After all, it's your body and your health. Understanding what's involved is an important part of surgery. You should also know that the risk of any surgery is higher for people who are very overweight. Heart disease, diabetes, and other serious health conditions can also increase the risk of complications. So it's important to ask your surgeon how these risks may relate to you. And while I'll go over 13 risks here, there are some very unusual risks that will not be covered. So please do not consider this list complete. Okay, let's begin. There is a risk of bleeding both during and after surgery. If there's bleeding after surgery, you may need to go back to the hospital or surgery center to treat it. Would you like some more information about this risk, or shall I go on? There is a risk that during the operation, the intestines, liver, spleen, or other organs may be injured. If this happens, another operation may be needed to fix the problem. There is a risk of lung infections or other breathing problems. There is a risk of infection. In rare cases, more surgery may be needed to treat an infection. There's a risk of blood clots that, in rare cases, can be life-threatening. There is a risk of leaks anywhere the stomach and small intestine are divided or reconnected. A leak can be life-threatening and needs to be treated right away. It is possible that, during surgery, a laparoscopic procedure may be changed to an open procedure. After surgery, there is a risk of developing malnutrition, anemia, or dehydration. There is a risk of ulcers at the edges of your new stomach. There is a risk the small intestine may become blocked. In rare cases, another operation may be needed to clear the block. There is an increased risk of gallstones. There's a risk of bad or allergic reactions to the anesthesia, medications, or materials that are used. While it's very rare, you can die from a serious reaction. There is a risk of a stroke, heart attack, or death. At this point, do you want to make any notes? Okay, let's move on. Now, as you probably know, there are alternatives to a gastric bypass. Of course, one option is to not have surgery and to continue trying to lose weight with diet and exercise. But you're watching this because you've tried everything and have found that success has only been temporary. And while not losing weight is an option, it's an unhealthy one. Staying at the same weight continues to put you at a high risk for illness and conditions like high blood pressure, diabetes, heart disease, and sleep disorders. Now, for some people, combining medications with diet and exercise to help them lose weight may be an option. Your doctor can give you more information if you're interested. And there are other types of weight loss surgery. You may have heard of a procedure known as sleeve gastrectomy. With this, most of the stomach is removed, so all that's left is a long sleeve. There's also a procedure known as a duodenal switch. Like gastric bypass, this surgery shrinks the size of the stomach and reroutes food around the small intestine. But in this operation, the stomach pouch is bigger and more of the small intestine is bypassed. Now, you and your surgeon can discuss whether any of these other procedures might work for you. The one thing I want to leave you with is this. Losing weight and managing problems like diabetes may help save your life. But remember, you are responsible for your weight loss. The surgery just makes it easier.